Aidan, Carey. This is my infant trauma assessment. So myself and my partner are called to the home of a pediatric patient, approximately 6 months old, who fell off of the changing table. The mother has the baby in its arms and the baby's crying. All limbs are moving, but there's a large raised hematoma on the back of the infant's head. The mother is frantic and hesitant to hand the baby over to us. PPE, we're going to wear gloves. Equipment, we're going to bring a pediatric bag, trauma bag, backboard, and a pediatric collar. We're also going to consider C-spine. As we arrive on scene, my partner is going to try to calm the mother down while I do the trauma assessment. During the trauma assessment, I'm going to start on the back of the head where there's a report of a small hematoma. So I'm going to start on the back of the head, go up to the front. I'm going to look at the ears, the face, and then work my way down to the neck. I'm going to go to the sternum, arms, down to the groin, and then I'm going to check both the legs and feet. During my trauma assessment, I only find a small hematoma, and the baby's consciousness is still intact, and it remains crying. ABCs, the airway is open and patent. Breathing, I'm going to auscultate the baby in its on its chest and back. Circulation, I'm also going to palpate the child. And then I'm going to move on to my vital signs. I'm going to check for pulse on the brachial artery, and the pulse is 180, and respirations are 38, and the child is conscious and alert. Sample history, the hematoma to the back of the head. The baby has no known allergies, no medication, and no past medical history. And it was last nursed 45 minutes ago. Last oral intake was 45 minutes ago. And the mother let the child lay on the changing table while she turned to grab a diaper. So my interventions for this, since it is a fall victim, I want to stabilize the neck and head, especially since there's signs of head trauma already due to the small hematoma. So I'm going to use if my department has one, I'm going to use the pediatric C-collar, and I'm going to stabilize the patient on the backboard using padding. Since the patient is crying, it's going to have increased respirations, so I'm going to give it a nasal cannula at 8 liters per minute. And I'm also going to rapid transport due to the fact that there's a head injury and that the patient's condition could worsen over time. And while transporting, I'm going to assess the patient every 5 minutes. Once I'm to the hospital, my missed report is I have an infant approximately 3 months old. Its chief complaint is a hematoma on the back of the head caused by a fall off the changing table. Interventions include neck and head stabilization and oxygen via nasal cannula. No known allergies, no past medical histories or medication, and the baby its last oral intake was 45 minutes prior.